am Dr. Vijayakumar Narayanan. I did my basic medical graduation from Kerala, South India. For the men, the most important cancer that we are dealing here in this part of the country is prostate cancer. We don't know exactly what is the reason why the number of prostate cancer is very high among men and number of breast cancer are very high among women. There are so many reasons. If you ask me a single reason why a person is getting cancer, I don't have any answer. That's the unique nature of the disease. The cancer is not a disease as such. Actually, cancer is a syndrome. It's a symptom complex. You cannot define cancer in single word and all. It has got so many wide manifestations. Cancer by itself, you can say simply as an unwanted growth or something, which is growing onto other areas of the body or metastasizing and causing troubles to the person. But that is not the only problem about cancer. Cancer can cause immunosuppression, profound immunosuppression. That is an immunocompromised state. When you have an immunosuppression, you can expect any opportunistic infections like tuberculosis, all other things. These are all immunocompromised state that is coming. Like HIV, for example. HIV is an immunocompromised state. So similarly in cancer, because of this immunocompromised nature, the patient can develop any other diseases as well. Then cancer is a hypercoagulable. That means the possibility of clotting inside the body is very high in cancer. So many things are there associated with the cancer. So you cannot pinpoint that this is cancer and this is this. That is not like that. Cancer is a symptom complex and that can affect practically any part of the body. And if you can diagnose the cancer in a fairly early stage, 1/3 of the cancers are completely curable. So people ask me, when you treat cancer, what are your messages? Yes, I should say, number one, early detection, very important thing. If you can detect the cancer in an early stage, as I told you, 1/3 of the cancers are completely curable. Next 1/3 of the patients, that is not curable but controllable. We call it as palliative treatment. We will control the disease with excellent medications that are coming up into the market on a daily basis. You see, in the cancer treatment, the treatment improvements in the treatment is actually happening on a day-to-day basis. Informations are not doubling, it is quadrupling. So we can access almost every medicine that is available anywhere in the world. So with the advent of the new drugs, we can control or we can contain the disease for a good period of time. This is next 1/3 of the patient. And the last 1/3 of the patient, you cannot control the disease, you cannot cure the disease. Then what can we do? Still we can do a lot of things. We can offer them the best palliative care. That means we can make them symptom-free, pain-free, the best quality of life can be assured. See, actually I am doing a research in thanatology, that is the death education. When we read more and more about it, even the last 24 hours do matter for a patient who is having a terminal illness. So many things are there. We can arrange a prayer meeting. We can talk to the patient. We can prime or we can desensitize the family to cope with the grief reactions, and also so many things can be offered. So this is how we usually manage 1/3, 1/3, 1/3 like that. So for me, as an oncologist for last 20 years or more, my suggestion is you don't have to be afraid of the cancer. What you need to be afraid of is the delay in detection and seeking a proper treatment. That's it. Thank you for joining with me for this discussion on cancer, especially the breast cancer and prostate cancer. I'm an oncologist and you can book my services through ponea.com, and ponea.com is a wonderful service provider for different specialties of medicine, and you can access my oncology services through ponea.com. Thank you very much.